we've been using this age for a long time, but there was a lot of discussion and controversy throughout the county with the ages, specifically the age for a trauma patient. So you notice for the medical patient, under 18 is considered a child. For the trauma patient, the age is 15 and under is the child, 16 is an adult. So if we had a patient meeting trauma alert criteria and they were 16, where would we take them? Exactly. If they were 15, where would we take them? Broward Health or Memorial, exactly. Okay, is that clear? So this screen we put on just some general guidelines of what a normal vital signs would be. The one I would tell you to just make sure you're taking note of is the blood pressure for the child. So when we talked about using the push dose epi, we said the endpoint was the blood pressure. Well, depending on the age, that is going to be different. So a good one to remember is the 70 plus 2 times the age. So is that the ideal blood pressure for a pediatric? No, correct, it is not. But what that is, that's the 5th percentile. So basically that's the lowest blood pressure that we would be saying that that patient is compensating. Anything lower, they're hypotensive. So when we're using that push dose epi, you want to keep giving it until you're at very least that 5th percentile or 70th plus 2 times the age. So that's a good number to remember. Okay, this part brings up a lot of controversy or discussion, how you want to look at it. Priority 1 patient is a cardiac arrest or a respiratory arrest. So you'll see later on, we're going to differentiate our cardiac arrest into a primary arrest. We're saying we think it's cardiac in nature, or a secondary arrest. We think it's respiratory in nature. So if we think it's primary in nature, we're now going to bring our patient to a STEMI facility. So the question has been asked frequently. I walk into a nursing home, 90-year-old, unknown history. The staff isn't very familiar with the patient. They don't really know what is that patient, a primary or secondary arrest? Primary. A primary, exactly. If you know that they were a drowning victim, if you know they were choking before they went into cardiac arrest, those are examples that you would use the secondary algorithm. But for adults, as a general rule, they're going to be a primary arrest. So if we have a primary arrest, and now we're saying we have to take them to a STEMI facility, where would we take them? Or let's make it easier. Where would you not take them in our catch of hospitals? Right, so as of today, we just wouldn't be able to go to Imperial Point. Now, keep in mind, they have a cath lab. They're working on becoming a STEMI facility. But as of today, they don't meet our criteria of being able to bring a STEMI alert to them. Hopefully, very soon, we will be able to, and it'll make it a lot easier. But as of today, we're not able to do that. Okay, is that clear? So where would we go? Yeah, North Broward, Holy Cross, Northwest, exactly. Good, okay. A priority 2 patient, unstable. Priority 3, very stable. We've been using very similar terminology all along. Is real consistent of what those mean. So now we're talking only about pediatric patients. So if you're working a pediatric cardiac arrest and you get ROSC. So what is ROSC? Yeah, so you get a pulse return. If you get ROSC, where am I going to go? To a comprehensive pediatric facility. So the next sensible question is, well, what is a comprehensive pediatric facility? It is a facility that has pediatric admitting, surgical options, and a PICU. So right now, we're going to say that Broward Health or Memorial are your comprehensives. So people were asking, well, what about Northwest? Northwest does admit pediatrics, and they're a great option to bring pediatrics. But when we talk about comprehensive centers, as of today, they would not be considered a comprehensive. Okay, and we'll talk about pediatric, whether they admit or not in a second. So with a pulse return, we're going to the comprehensive. If they don't have a pulse return, so we're still working the code, where would they go? Closest appropriate. But what does that mean? That means they'd go to the closest pediatric facility. So who's not a pediatric facility? Okay, so when you talk about this, we need to look at our hospital matrix. So on the app, there's a hospital matrix. So when you look at it, it lists the hospitals that are pediatric and then ones that admit. So when we're talking about a critical pediatric patient and we say which is the appropriate facility, we're talking about a pediatric hospital. We're not concerned whether they admit the patient at this point. So who would not be?
No one.
No one, exactly. Every hospital in our area is designated as a pediatric hospital. So you could go to the closest facility with that patient. So the topic always comes up, well, they don't admit. Well, Broward Health and Memorial are set up in the very similar ways. It's much more cost effective to have one central hospital that admits. They have outlying hospitals that filter the patients in. That's the way the systems are set up. So there was long discussion about what's better to do for the patient. Do we bypass hospitals to go to a comprehensive, or do we go to the closest hospital, make sure the patient's stable, and then allow them to transfer? All the medical directors agree the only option for us is to go to the closest appropriate. There was a lot of discussion on it. And so if that question ever comes up, we would not bypass hospitals to go to a comprehensive. You would go to the closest appropriate pediatric facility. And we're fortunate that all of those meet that criteria for us. Okay, is there any questions on that? You good? Okay. Priority 2 patients, closest appropriate hospital. Priority 3, meaning a low acuity. We left in there the freestanding emergency rooms. We don't have any in our area right now. The closest one that I know of is Boca West. Unless someone specifically asks for you to go there, we don't advocate making that an option. Even the areas that have those, the problem you come into is if they have to be transferred or not. So the general consensus is yes, if they're adamantly asking to go to that center, it could be an option if you get permission from the battalion, but as a general rule, we're going to transport to emergency department. Okay, trauma patients. We try to take out all the guesswork in this protocol. So one of the questions that always used to come up was, what if a patient's over 20 weeks pregnant and they meet trauma alert criteria? Now this one, you could argue either way. You could argue go to the closest trauma center, save the mom, save the baby. Go to the OB center, save the baby. The best option that the medical directors decided was to go to a trauma OB facility. So where does that mean? You're right, so Broward Health or Memorial, right, okay? So it takes the guesswork out of that. STEMI alerts, we'll talk later about what constitutes a STEMI alert. It changed a little bit. And stroke alerts. Where do we transport stroke alerts? Not a hospital. What category? Primary or comprehensive? Exactly. So comprehensive. In Broward County, we only transport stroke patients to comprehensive. You have a longer window or a wider window, and they have more options for treatments. So if you had a stroke, what would be the hospitals at this point you could not transport to? Imperial would be one currently.
Northwest?
And Northwest, exactly. A lot of people don't know Northwest is only a primary at this time. I believe they're working on becoming comprehensive, but at this point, we would not go to Imperial or Northwest, exactly. So we have plenty of options. Any questions on that? We good? Okay. We talked about pediatric strokes at length, and again, there was a lot of variation of which hospital had coverage, so the decision was made If it's a pediatric stroke, they go to Broward Health or Memorial. That way, the patients get consistent care. It doesn't depend on the day. For OB, we already talked about if they meet trauma alert criteria, but what if it's just a medical code, a medical cardiac arrest? Where do we go? Again, you could argue it both ways. And we decided the best option for both the mother and the baby was to go to an OB hospital. So what would be the two closest OB hospitals we have? Holy Cross and Northwest, exactly. All right, any questions? We try to take all the guesswork out. Now, if there's some reason why you feel you need to go to a different hospital, that might be a good time to utilize that two medics agree. You justify why. If you're doing it with good faith, that would be an appropriate reason. Because I'm sure we could all come up with examples when we might want to consider deviating. Okay, so for this, decompression and carbon monoxide, the key point is you want to go somewhere with a helipad. We're not going to get involved into which chambers open, which one's available, which one's not. We're going to bring the patient to a hospital with a helipad, and that hospital will find out the appropriate facility. So most likely for us, which hospital would we take the patient to? North Broward, exactly. Now, when we talk about psychiatric patients, where do we take psychiatric patients? IPH. And why do you say IPH?
Because they have a appropriate psych facility.
Right, so they are a psych facility, but we take them there because it works well for us. We have a good relationship with them. BSO has a nice handoff. So if that works, I'm not saying don't go there. But just be aware, when we transport a psychiatric patient, we are transporting them for medical clearance. End of story. So in reality, we could go to any emergency room. They get medically cleared, and then they get transferred to the appropriate psychiatric facility. So if it happens to work out that everyone wants to go to Imperial Point, that's perfect. But don't feel like you're obligated to it. If there's some reason why you feel it's in the patient's best interest to go to a closer facility, you absolutely can. Now, in the old Northridge, they moved Florida Hospital there, which is a very nice psychiatric hospital that does pediatrics, adults. What if one of the BSO officers says, let's just transport him right there? Could we do that?
You have to get advance orders from the battalion chief, I would assume.
What do you think? Even if the battalion said, yeah, go ahead. This is a newer thing, so we're all learning this. The answer is no. And the reason is they have no capability of medically clearing them. So even if we did, they would say, you know, we'd love to have the patient, but you have to go to the emergency room and get him medically cleared. Okay, is that clear?
Yes.
All right. We put some language for the helicopter. BSO, they now have a separate helicopter for EMS and police. So it was supposed to have gone on board last month. I believe it may have gone on board yesterday or today. So we're going to have a lot of more options. They're actually going to come to the department and talk to us specifics. But the only thing I will tell you is the weight is a big factor. So if we are requesting the helicopter, you're going to want to know the weight of the patient. And depending on how many crew they have, how much fuel they have on board, will determine whether they can take the patient or not. And they'll go over what they can handle and what they can't. But they're excited about having the separation, and the medics are now going to be carrying blood, like Chief Galgano mentioned, so I think we're going to probably start utilizing them quite a bit more. All right, that concludes the general information section. Any questions on that section? Okay, let's take a 5-minute break.